Hello everyone, I am Dr. Ghanee. I am an oral pathologist. I see patients with oral lesions, oral sores, oral cancer. Today I want to show you a common lesion that can occur in the oral cavity, and it's called squamous papilloma. As you can see in this case, it is on the throat area and it always has this kind of irregular papillary surface. Squamous papilloma is caused by human papilloma virus. This virus can cause different diseases, and as you can see here, it has different subtypes. But today we just talk about the squamous papilloma that is caused by HPV type 6 and 11, and it occurs in the oral cavity. A squamous papilloma in oral cavity has a good behavior. First of all, it never gets really large, usually is less than 1 centimeter. Also, it doesn't multiply. If we don't get it removed, unlike skin warts that usually 1 becomes 2 and 3 and 4, it stays as 1. Also, the other thing is it never changes to cancer. It does not show malignant transformation. Still, it is recommended to get it removed because it's caused by this virus and it can be transmitted. A squamous papilloma in the oral cavity can show with different features. That's why I'm going to show you here all the different features of a squamous papilloma. The one that usually occurs on top of the tongue has strands like this, hair strands, and I call it troll hair pattern. And as you can see, this patient has exact same thing underneath the tongue and on the side. This pattern is more flat and papillary projections are very small, and this is usually on the lower lip. Same lesion showing these features. And this one also occurs, this pattern that I call it artichoke pattern, occurs on the lower lip, usually areas that we keep biting and we irritate it. And sometimes it's flat and papillary projections are really small. In the back of throat, close to uvula, sometimes it has this kind of mulberry pattern. It is oval kind of shape when we look at it, and the papillary projections are not really large. And in areas that, again, we bite and bite, especially underneath the tongue, it can get very keratinized and very firm, and we call this potato sprout pattern. This is condyloma. It's HPV type 6 and 11. It occurs in the oral cavity and on genitalia. It gets transmitted, and usually this is large and in multiple form, and we call it the moss pattern. Another feature of a squamous papilloma, cauliflower pattern, and this one also occurs in the back of throat, also on top of the tongue. And sometimes projections are smaller, as you can see here. This is underneath the tongue. This is another one, back of the throat, and same cauliflower pattern on top of the tongue. I hope you liked the video. Thank you so much for listening.